For sure. I presented with like some low back QL and just kind of general hip flexor, posterior chain pain from old injuries. And I wanted to work on that, and I also wanted to improve my athleticism for sports, for jiu-jitsu, for ultimate frisbee, and definitely hard course of training. Really, some really difficult stuff, but all of it sort of wove together very well. And my pain is the pain that I was dealing with is on a daily is gone. I no longer have daily chronic low back pain from doing activities or just day to day. So
Great,
yeah, good.
great. And before coming in, what have you tried before?
I tried you know, your usual gamut of activities. I did physical therapy for summers. I did massage. I also did myofascial work with sort of a physical therapy studio
Mm,
back on the West Coast. Um, I obviously strength trained a lot.
right.
Strength training did not like assuredly fix the issues. Sometimes strength training helped, and sometimes strength training actually made it worse. So it was very like, up down with strength training. Although I still do incorporate a lot of strength training, but um, HyperArt changed the way I approach my training, and I think I definitely approach my training in a more mixed way now, trying to incorporate more of the elements of some of the exercises that we do here into my day to day, my weekly block training and stuff. So yeah,
Right. And what were you feeling when you were doing the elevated tall curls before?
pain.
Just pain in the hip flexor.
Yeah, pain sometimes in the hip flexor, sometimes just burning in the foot, and now the towel curls innervate the glute and the the glute connection. So
You can feel the glutes now.
I guess I shouldn't say innervate, but yeah, I can feel the glutes. And I feel
Well,
my glutes also when I'm doing day-to-day activities like walking, which is like an engaging, being able to, feel all the rest of my body instead of just sort of the posterior chain pain areas has been really cool. So yeah, it's
perfect.
changed the way I move.
Great. And last question I have for you is before doing this training, like what made sense to you in our messaging?
Yeah, yeah. I think mostly the the advertising, but also, just looking at the exercise selection that you have on social media and about the foot, about the fascial connection. I know a lot of people with dead feet and flat feet. And that's not coming from a physiologically and from like just a human anatomy perspective, it's not really generally supposed to be that way. And I've never had flat feet, but I definitely had foot pain. I had plantar fasciitis at various points throughout my injury history. And now I understand, what the feet do. So that was probably what drew me in initially. Also, I think someone referenced me to the page on Instagram, but yeah, otherwise it was um the the foot exercise, the foot. I want to say foot stuff, but yeah.
Okay, perfect. Very good. Thank you so much.